Welcome, folks, to the next edition of MoveMint Medicine podcast. And today is a very special edition. But before getting to our guest today, the special guest, first we'll thank our partners. So, Fit India Movement, thank you so much for partnering with us. And Back to Fitness, the clinic that I run, and Lal to the High, the race that we put together in Ladakh. And then the movie that we are making on the 10th edition of Lal to the High called Moving Mountains Within. And now coming to the guest. So, we have Dr. Anant Joshi. Thank you so much for coming today to our podcast. So we'll just get into it, sir. So you're, like starting with the professional and your academic background. So please take us through that, sir.
Rajat, first of all, I think I should thank you for having me on this program. I have watched a couple of podcasts which you already have put on the net. And I'm amazed to listen to stories of people who have really gone way beyond, really committed to fitness. And some of them have managed not only to change their genes, but their body types. They have gone from endomorphs to ectomorphs. And it's amazing to see some of these stories. It's really very, very inspiring. I don't think my story is anywhere close to all the stories that you have already put across. But anyway, let us go through with this. I'll quickly share with you my background. I am an orthopedic surgeon practicing in the city of Mumbai. And I will take you through some of my presentations, because I felt that instead of people watching me just yapping, it might be better if they are able to see some visuals along with this. So after completing my orthopedics from Grant Medical College and JJ Group of Hospitals in Mumbai, I went to the United States in 1982 and got trained in arthroscopy and sports medicine. And arthroscopy was really a novel field at that time, and I subspecialized in arthroscopy at that time. For people who are not medical doctors, arthroscopy basically means keyhole surgery of joints. Arthros means a joint and scopos means looking into a joint. So arthroscopy basically means keyhole surgery of joints. In 1982, I was at the United States Sports Academy. I did my master's in sports medicine and fitness management. I had a lot of hair then and looked completely different. And now all that is gone. But I think in 1984, coming back with arthroscopy and sports medicine as a qualification was extremely unusual. And so I got the advantage of first mover in those years. So 1984 was when I returned to India. And I've always been in private practice right from then, because none of the government hospitals would want anyone who was super specialized to be on their staff at all. We always believed that everybody should do all kinds of work. But here I was, who was basically determined just to stick to a specialty or a super specialty, if you may call it. So in 1986, I started off with my first clinic, which was called the Bones and Joints Clinic. I think it was wrongly named the Bones and Joints Clinic because I was really not treating fractures. In fact, there was a time when one of the patients came to me with a collisis fracture. The collisis fracture is a fracture of the wrist, which is the bread, butter and jam of somebody who starts doing orthopedic surgery. And when she came to me, I said, sorry, I don't treat fractures. I treat only joints. I do arthroscopic surgery. So she went to a senior orthopedic surgeon who was in the city of Mumbai at that time. And when he heard what she had told him, he said that this guy, I don't know who this guy is, a weirdo, and probably he's going to die hungry. A few years down the line, I just happened to meet this orthopedic surgeon in a meeting, and he said, Anant, you are right in what you did. Today, I am dying hungry and you are where you are. So, I think sticking to a super specialty really helped me and being the first mover. I rectified this mistake in the name, and in 1991, I expanded my clinic a little bit. Now, you know that in the city of Mumbai, we run our clinics through cubby holes because of the real estate in Mumbai. So from 500 square feet, I moved to 1500 square feet. But even when I started in 500 square feet, my aim was always to have an integrated sports medicine clinic. So even in my 500 square feet, I had an operating room, I had portable X-ray, I had a physiotherapy unit, and all this was fitted exactly in 550 square feet. From there on, 1500 square feet was a luxury, and here I had two consulting rooms and a bigger operation theater. This was inaugurated by the Master Blaster Sunil Gavaskar. By that time, because I was pretty well known in sports medicine, I was associated with the Board of Cricket Control. I was also a part of the advisory team to the Sports Authority of India. And I came across, I had the opportunity of interacting with a lot of star players of those days. In fact, I was also associated with the MRF Pace Foundation. But cricket in the 90s and later on became so popular that your name started being associated with some personality in sports. And fortunately, my name was associated with Sachin, and it almost became like I was Sachin's doctor. So that was really what happened during those days. Besides my clinics, on every weekend, I used to be traveling to different parts of India and operating. So I was traveling right from Kashmir, operating in Srinagar. I was in Guwahati, Calcutta, Goa. So I was going to almost 10 cities all over the country and operating. And that exposed me to a lot of sportsmen, both the ones who are affording and the non-affording. And I made sure that these services were available to all. My dream for a real integrated sports medicine clinic, however, came 30 years after I started practice. And in 2013, we started this sports medicine, SportsMed Mumbai, which is a completely integrated sports medicine center. Here we have a surgical suite where we have different surgeons who specialize in different areas. We have a shoulder, elbow, and wrist specialist. We have a foot and ankle specialist. We have back specialist. We have 2 knee surgeons. We have a rheumatologist. And more importantly, we have in-house musculoskeletal imaging. And we have some of the top musculoskeletal radiologists who work with us. You know, Aditya Daftari is very well known. He's a part of our team. And to make sure that, I always believe that surgery is not the end all for anything. Physiotherapy is a must. So we expanded, we had a team, and we also went into setting up SportsMed Active, which is our unit of rehab facility. Here we have sports scientists who looks after training and evaluating of athletes, and we have physiotherapists also. So this is my journey so far, and this is where we are today. We are a fantastic team of doctors working together at SportsMed Mumbai and SportsMed Active.
That is so brilliant, sir. I mean, the first mover, isn't it? I mean, when people didn't even know the meaning of sports medicine is when you started, sir. So what about the personal experience, your own journey as far as fitness and running and cycling we spoke about some years ago? So how has it been for you, sir, with that?
I have never had to start fitness all over again from 40s like most other people whom I saw on your podcast. I have been an outdoor person right from the beginning. And in fact, my father encouraged me to be into sports. He always felt that sports and academics has to be balanced. He looked at sports as a co-curricular activity rather than an extracurricular activity. And at the age of 11, in fact, he enrolled me in Talwalkar Gymnasium, where I am still a life member. Of course, they have packed up, but I am still a member of the Talwalkar Gym. But from the age of 11, he encouraged me to be into sports. I was into all kinds of sports. I was basically an outdoor guy. But ultimately, after playing all the sports, I was finally drawn to badminton, which happened to be my forte. And in badminton, I found that was the game I liked. So I really went all out into badminton. I played for Bombay, for my school, my college. I won the Bombay University badminton title for 2 years. I captained the University of Mumbai. During the medical college days, I won the All India Inter-Medical 4 times in a row. And so I did not give up sports even during my medical days. So sports was never on the backbencher. It was always probably I was a backbencher and sports was always in the front. So when it came to academics, I was a backbencher. But for me, sports was always a priority. So badminton was my first love. Unfortunately, when I went to the United States for my uh, post graduation, I found that there was no scope for badminton. So I shifted to tennis. And since I was a driven guy, I played at the 3.5 level and the 4 levels of tennis, even in the club level tennis in the United States. When I was in my practice, even in my heydays of practice, I made sure that I had time for tennis. So I used to operate from 6 o'clock in the morning to 12 o'clock in the 12 noon. And then from 12 noon and till 1 in the afternoon, I used to have a marker with whom I used to knock for 1 hour of my tennis. So I continued with my tennis. But I think all these high impact sports finally took a toll on me. And I had to shift to low impact sports like cycling. And the reason why I had to, these high impact sports had to take a backseat was because I had my first knee surgery, removal of meniscus in 1989. I had my second knee surgery in 1999, 10 years later. And here you can see me with that frame on my leg. And, I had bow legs, which my legs were kind of bandy. Most of the top athletes will see that their legs are not straight. You rarely find a knock-kneed individual. Most of them are bow legs. And I think bow legs are an asset, but they're also a disadvantage as you grow older. So I had to correct my bowing of the legs. And you see this Elizaro frame on my leg. And my knee was corrected to prevent osteoarthritis from increasing. And this was in 99. And that is the time I also had 2 back surgeries. People felt that I love to be under the knife. And a lot of my surgeons said that you are ready to undergo the knife for anything. But I wanted to be active at any cost. I did not want any kind of ailment to hamper my active lifestyle. And so I was willing to take the risk of surgery. So I had 2 back surgeries, 1 neck surgery, 3 knee surgeries. And I'm still extremely active. So I think that is a take-home message. People very often feel that, oh, surgery should not be done. It will hamper my lifestyle. But I think surgery can, in fact, sometimes if correctly done, can prolong your sporting lifestyle. So I shifted to low-impact sports. I went to scuba diving. I also dabbled a bit in underwater photography, and these are some of the photographs that I had taken. And then it was finally, it came to cycling, which was my call. And today, cycling is everything for me. It is a means for commuting. I go to my clinic only on the cycle. I don't use the car at all. It is a serious hobby now. And whenever I travel to any part of the country, I travel with my folding bike, and so I don't miss out on exercise. So it has become my travel companion and route to fitness. Now, how I got into cycling is a very interesting story. I was not a cyclist to begin with. There was a patient who came to me in 2002. He was Mustafa, who worked for Mercedes-Benz in Kuwait. He was sent to me for surgery of the knee ligament. And when I examined him, I said, you don't need surgery. And it was rather shocking because coming from a surgeon that you don't need surgery was something which takes very often people aback. But I believe a good surgeon is one who operates, who knows when not to operate and when to operate. And I think that is the key to success of any good surgeon. So when I told him that he did not need surgery, we rehabbed him and he was perfectly normal. He was extremely grateful. Every holiday that he came to India, he presented me with a Mercedes-Benz memento, like a cap, like a tie pin, a jersey. And he tried to convince me that I should buy the Mercedes S-Class, some fancy car. And when he saw no response coming from my side, he started feeling that probably this man cannot afford this kind of luxury. So he said, you know, doctor, Mercedes-Benz also makes cycles. And so I said, well, let me look into it. So at that time, I was in the process of changing houses in Mumbai, and houses in Mumbai are so small that I didn't even know whether my house would have a place for a cycle. So I kept on dilly-dallying, and the next thing I find is that he lands up with his Mercedes-Benz cycle and gives it to me. So that is how I got my first cycle, a Mercedes-Benz cycle. I started commuting on this cycle, and it was a attraction in the city of Mumbai because somebody riding a cycle, a Mercedes-Benz cycle, was a sight, because only the actors of those times, the top actors, had something like this. So that was my beginning of cycling. This was, of course, not very serious. I used to just cycle to work. I always was a gym person, so I did a little bit of gym. But my serious cycling was in 2014 when I enrolled for the tour of Nilgiris. Now, the tour of Nilgiris is a very serious cycling event. It is one of the tough cycling events in India. And it so happened that a physiotherapist landed up at our clinic. He was associated with the tour of the Nilgiris. And he saw me commuting to the clinic on my cycle. And he said, why don't you enroll for the tour of the Nilgiris? And without batting an eyelid, with all my bravado, I said, sure, I can do it. Let me enroll for it. So I enrolled for it. Aditya also enrolled for it. We never knew what this tour of Nilgiris was. Till we started blogging and trying to find out what is this tour of Nilgiris. So we realized that this is a tough tour which takes you it goes on for a week, and it takes you through 3 wildlife sanctuaries, and the distance that you cover is somewhere close to 900 kilometers. It starts in Bangalore and it ends in Munnar. We thought it was going to be a joyride, so we went on the blog to find out if anybody had blogged about the TFN, and they found that what we were up against. And we were up against this Kalahati climb, which is called the wall. And here you have a climb which is extremely steep. It is one of the non-classifiable climbs, and it can easily feature among the toughest climbs around the world. Not just that, the Kalahati climb has what you call 36 hairpin bends. On the 15th hairpin bend, it says that free mortuary van is available. And if you manage to get to the 36th, then an ambulance was available to take you wherever you wanted. So then we realized that this was no ordinary cycling trip that we had enrolled for. And that is when we started looking at it rather seriously. And the first thing I did was I bought a cycling book, which was, of course, my first guide to cycling, that is Idiot's Guide to Cycling. I started reading that. I went on the YouTube to find out how I could climb a ghat, and I started practicing it. The closest ghat to Mumbai was Khopoli, so we started going to Khopoli and climbing the ghats there. And it all told us that you sit upright, you start breathing, and you keep on shifting gears. But we had also read in the blog that you can keep on shifting gears till you finally end up having no gears at all. So I made sure that I had invested in the right cycle. I also started taking advice from whomever I met. I was in Haridwar at that time, and I met this Baba, and I asked this Baba, Baba, do you have any advice for cycling? And he said, Sukh ka socho, dukh ka socho mat, upar dekhna hi mat, niche dekho aur cycle chalate jao. So that was the advice the Baba gave me. You know, the percussionist Shivamani was our patient. He came to me at our clinic, and I asked him, Shivamani, do you have any advice? And he said, Doc, for me, rhythm is God. So I took a hint. I said, if you keep on cycling rhythmically, then maybe you can reach God. So that is what the tip I got from Shivamani. I upgraded my cycle to whatever best gears possible. And gears cost more than the cycle itself. But I made sure that I invested properly in the equipment. And the tour of Nilgiris is not something that you can keep on cycling for 100 kilometers over the entire day. You have fixed time limits to reach a particular spot, because it starts getting dark, and if you are cycling through wildlife sanctuaries, they don't want to take chances. So there is a sweeper van which follows you, And if at a particular time you have not reached the spot, then you need to get into the sweeper van, and you don't get a completion certificate once you are in the sweeper van. So I did the tour of Nilgiris, and here I was. I had a sound box which was mounted on my cycle, and I had this music playing. And a lot of these youngsters who were wanting to give up used to be on the sidelines. And when they used to see me, I was the oldest in that category at 60. And whenever they used to see me cycling past, they used to get encouraged and they used to keep on cycling. And some of them managed to complete the entire thing without getting into the sweeper van. So the icing and on the cake for me after the TFN was I was awarded the most inspiring cyclist of 2014. So I think that really gave me a boosted my ego. And then in 2015, I cycled from Manali to Leh, of course, where you organize your ultra running marathons. So I cycled from Manali to Leh to Srinagar. So that was something completely different experience, cycling at that rarefied air and the atmosphere that you go through. And that was really superb. I was so much out on the cycle that my wife then started suspecting that there was something happening on the sidelines. So she wanted to make sure that I was not having an affair besides cycling with someone else. So she took to cycling seriously. And now she has joined me. So instead of my cycling escapades, it has become our cycling escapades. So that's a good thing that has happened. And then we cycled, every year we take these cycling trips, which are 500 plus, multiples of these, at least 3 cycling trips I do in a year, which are 500 plus. Sri Lanka has now become our favorite cycling destination because of the proximity of the island and the superb roads and the clean environment that it has. So Sri Lanka is now on the top list. So these are the things that I did 2018 and 2017. So you can see the cycling. My cycling rubbed off on my fellows as well. So every new fellow who came to the clinic took to cycling, and we took this trip and to Zanskar. And so this was our group which went to Zanskar. We all have our mountain bikes, and we were cycling in Zanskar. Cycling allows you to cover a lot of distances. You can go to the interiors. You can really, experience what it is there to be in the small villages. You need to test yourself here. You can see my son who was cycling even though it was snowing. And here we were all freezing in Sarchu at -2 degrees. Photography has been my passion, and here I tried some drone photography, and that was a fantastic experience. We got some really superb views of cycling. So we did some drone photography during this last trip to Zanskar. So all this really keeps on encouraging you, and cycling becomes a part of you. You want to keep on doing this. And this is what we have done in Zanskar. And, being a photographer, I have been using all my cycling trips to make coffee table books. And so I have these coffee table books of each of my cycling trips: cycling in Spain, cycling in Rajasthan, cycling in Sri Lanka. And I said, I experienced heaven in the land of Ravana. And that is why Sri Lanka is my favorite now. A really good destination to cycle, close to home, and superb conditions and excellent food as well. So now I invest only in cycles. I don't look at cars anymore. And if you enter my garage, you will find that I have a huge collection of cycles. I have a mountain bike, I have a road bike, I have 2 road bikes. This is my wife's bike. I have a state-of-the-art bike, and I have a folding cycle. So my investments have gone from cars to cycles, and I keep on looking at more and more fancy cycles which I can invest in and probably use them. They are not just showcase. They are not kept in the garage. They are used. So cycles have become more precious for me than the car. My cars are parked outside and my cycles are parked in the garage. In 2019, I took this trip, which was quite daunting. It was 14 days, and we cycled from the southern tip of UK to the northern tip. This is from Land's End to John O'Groats. And for this trip, I felt that I needed to train, and this was the first time I really took to serious training. And with a professional coach, I drew up a chart of how I would go about and peak at the right time. And I felt that this kind of scientific training really helped me in getting some fantastic changes in my fitness levels. So having a professional coach who can guide you, I think can really help, and it has increased my levels of fitness by leaps and bounds ever since I started having this professional training. Like we say, high intensity interval training is something I discovered at this time. I used to feel that at 65 I was doing something which is great and something unbelievable. But when I went for this Le Jog, the oldest participant in the group was this 75-year-old Peter Stokes, who was my guardian angel, who was looking after me while we cycled. And I realized that for Indians, 65 is we think that we are old, but for the Westerners, it's just the age is just a number, and I feel that is the right way of approach. And if at 75 I can be what I am at 65, I think that is something I would like to achieve. So that is what I have been doing. This is at the end of Le Jog, and that is my fitness journey so far. So I have got into cycling seriously, and I have reached a stage where people have started calling me a cyclepath, a person with an extreme love for bicycles.
That's brilliant. That's awesome. So comparing to, because you've been a sports person throughout,
Yes.
it becomes difficult to think about doctors who are not active. What do you think is the problem with the fraternity, sir? Because most of our colleagues are not active. They're slobs. They're very rounded, aerodynamic figures.
Absolutely.
How do we? What do we do?
I think they are so engrossed in their professions that they have a very narrow view of the world. I think you need to expand your view, look at the world outside, realize what you have been missing. Fortunately, I have seen an increasing trend amongst doctors to get to the outdoors. I think the previous generation, my father's generation probably, they were so much into the profession that they really were shut, the outside world was completely shut off. But now I see a lot of youngsters who are now taking to outdoor activities, to sports. In fact, if you see the number of runners on the streets of Mumbai today and the number of people who are participating in the marathons, I think it is an encouraging sign. Also, if you see the number of high-end cycles which are now being sold in India, I think it is an upward trend. People are now finally realizing that to fight off the sedentary illnesses that you get by the sedentary lifestyle like hypertension, obesity, cardiac disease, the only way you can fight these is by staying fit. I think doctors have started realizing it. I think as a doctor, you need to be a role model. And for my patients, I think we are all role models. We commute to our clinics on cycles. In fact, our clinic has a special parking place allocated for doctor cycles. So we have made all these changes. We work in the clinic in shorts and t-shirts. So patients can look at our fitness and say that, okay, this doctor is not just preaching, he's practicing what he preaches. So I think that, goes down to encourage other people to take to outdoor activities.
So, and so 3-4 myths that are there, in a lot of orthopedic colleagues would say, don't run. You run, you cause knee arthritis. Don't move, you'll cause injury. You're not going to Olympics, so why do a particular sport? So if you could, address 3-4 myths like that for the audience.
Absolutely. I think a major reason why a lot of patients are put off from doctors when it comes to exercise related injuries is because when they go to a doctor, they are told that you stop exercising and you take complete rest. As a sports doctor, we know that complete rest is not a solution for any kind of injury. We need to just rest the part which has been injured, and it is called relative rest. And you need to be, or you call it active rest. And that is what people need to understand, that even doctors need to understand. Unfortunately, exercise science is not a part of the medical curriculum. And I feel that as doctors, we need to understand more about exercise. We are been treating only diseases, but we are not really addressing the issues of fitness. And I think doctors need to look more into this part of health, preventive medicine, what I would call. And I think that is the way forward. In fact, in my clinic, whenever I get my patients don't get any prescription for drugs, because I don't believe in prescribing medicines, because I believe that medicines are nothing but chemicals that can play havoc with your bodies. So my prescription very often is for exercise and activity modification. So whenever patients are shocked to see that their prescription has no drug, and what I have prescribed is some form of exercise, maybe physiotherapy, some activity, and that is what I prescribe at my clinic. In fact, at our clinic, you don't see any medical reps waiting to meet the doctor, because we don't prescribe drugs at all. Most of us are into fitness and prescribing exercise prescription more than prescribing drugs.
So anything in conclusion for because this podcast is primarily meant for the layman. So anything to sum up for the patients at all?
I think I treat a lot of sports and exercise related injuries, and I feel you can break them down into three things. Most of these injuries are self inflicted injuries, because people don't listen to their bodies. Your body is an excellent mechanism which is giving you a perfect feedback. It tells you what kind of load you are putting in, whether that load is adequate, whether we have given it enough rest to adapt to that load. So I think listening to your body is extremely important. Body awareness while you're exercising is critical. I see a lot of patients having the mobiles on their phone and running on the treadmill. They really don't know what is happening to their legs, how their legs are, the biomechanics of running, is it right? So I feel getting distracted during exercise is what very often leads to an injury. The second thing I see is that most people don't do what is called a balanced exercise. So, they keep on attacking the same body part, or using or abusing the same body part over and over again. And I feel you need to do something like a circuit training, where you have identify your body parts and exercise on each one of them, so that you don't break down a particular body part. The third thing I feel is, very often I see injuries which are predominantly because of trainers and personal trainers. And I feel that trainers have their own agenda, and they don't address the needs of the person who has come for exercising. So you see a 45-year-old woman who has started exercising for the first time, doing all these functional training, where she has these heavy ropes, and she is banging those ropes. And when these people come to me with shoulder problems, and they tell me that they have been doing functional training, I said, instead of doing this, if you just wash your utensils at home, or you wash your own clothes, that would be better functional training. And I do that myself. I wash my own clothes, I wash utensils. I don't have somebody to lift up my bags. That for me is functional training. Functional training is basically putting your body through the same movements that you would do in your day-to-day activities. So injury prevention is a lot in your hands. Once you get an injury, I think you must listen to your body. You must make sure that you come back with the proper loading, the intensity, duration, frequency, and rest should properly be adjusted, so that you don't land up with a re-injury.
Oh, brilliant. Just actually, if you could emphasize about the recovery and the rest, sir. You mentioned that you just touched on it. How big a role does overloading or overtraining cause, and then the role of rest recovery?
Yeah. I think you need to know what are your requirements. I am in this group called Worley 545, which is a cycling group. They are all driven bankers. They are all bankers who are really younger guys who are constantly pushing themselves. I am a part of the group. I get motivated by them for sure, but I know what my limits are. So I don't try to chase them. I get motivated by them because I know that I don't want to overload and do something which will finally give me a setback. So overload injuries are something which are critical to avoid because they take a long time to recover. You can land up with a stress fracture. You can land up with tendinitis, which goes on and on. I think one of the better ways which I find to treat overuse injuries is hydrotherapy. And I prescribe that to a lot of my patients. If they have injuries which are chronic, I feel hydrotherapy, working out with in the water and in the pool, really helps in treating some of these injuries.
It's an absolute pleasure chatting to you, sir.
Thank
So
you.
thank you so much.
Thank you. Thanks.
Thank you. Thank you,
Thank you for
folks,
having.
for watching. Thank you, sir. Thank you. Thank you, folks, for watching another episode of Movement Medicine. And keep watching. And thank you so much again, sir.